Pericardium 7 is on the flexor aspect of the wrist. It's level with heart 7, and between two tendons, palmaris longus and flexor carpal radialis. Some people don't have this palmaris longus tendon, in which case you'd just be going ulnar to this flexor carpal radialis. So finding heart 7, articulate the wrist, coming between those two tendons, that if you can't see them, you can get the person to join their thumb and their little finger together, and that will highlight those two tendons. And just relax again. Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpal ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together, that will bring that tendon up. And just relax. Articulate the wrist and pop your point in. Large intestine 13 is 3 cm superior to large intestine 11. It's between the lateral borders of biceps brachii and the shaft of the humerus. If you divide the distance between the anterior axillary fold and large intestine 11 into thirds, the point just lies there.
Large intestine 14 is located on a line joining large intestine 11 to large intestine 15. It's often described as being 3/5 of the distance between large intestine 11 and large intestine 15, but this isn't always very accurate. The best way to find it is to have a person adduct their arm against pressure and then palpate down until you find a nice depression on the inferior aspect of the deltoid muscle. It's important to realise that when the arm is relaxed, this point isn't at the exact tip of the deltoid, it's slightly anterior and slightly superior on a line joining these 2 points. Stomach 31 is often described as being at the junction of a vertical line drawn through the anterior superior iliac spine and a horizontal line drawn through the greater trochanter. More importantly, it lays on the lateral aspect of the muscle sartorius. To bring this muscle into relief, have the person cross their legs. It should now be possible to palpate over sartorius and find a nice depression lateral to it. When the person brings their leg back to a resting position, you will find that this point may not lie exactly on where those 2 lines join. Spleen 11 is located on a line joining spleen 10 and spleen 12. It's half the distance between the inferior border of the patella and spleen 12. Gallbladder 38 is located 4 cm superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you palpate up from the lateral malleolus, feeling the posterior and anterior border of the fibula, it should be easy to find this point. Gallbladder 41 is located on the dorsum of the foot in a depression distal to the junction of the bases of the 4th and 5th metatarsals. If you articulate the 2 metatarsals, you'll be able to feel a nice groove in between their shafts. Gallbladder 41 is located lateral to the tendon of extensor digitorum longus, little toe branch. If you extend the toe, this will bring this tendon into relief.